sharing life experience to engage and impact community.
I'm LIBBY DUNAHOO. I'm the manager of the Respecting Choices Advanced Care Planning Program for the Northeast Georgia Health System.
DUANE SCHLERETH. I'm a transplant from Western Canada, but I've been in Gainesville since 1983.
My name is PHYLLIS SOLGERE, and I worked on the Plan in a Can project.
It's a really simple tool with a really huge purpose. The whole point is that it helps people be prepared in case of an emergency. And that's a real gift, because in an emergency, in a crisis, nobody wants to call 911, but usually you're just so overwhelmed with the crisis. The things that you need to be prepared to go to the hospital are not usually the things that people can remember. And so it's a way of putting all of those things in one place, and then it's easy, and it's feeling prepared in a crisis. And so it's one of those things that we think is a really great gift.
Well, you know what, we did a lot of different things. Fortunately, we didn't have to develop this plan from the ground up. It was already something that existed, and so we kind of built on that foundation. But we still, needed to get something that would work here, and also something that, it was so important to make sure that the population knew about, because it's, it doesn't really do a lot of good, just to have something that is written down and nobody is implementing it.
Plan in the Can takes an empty tennis ball can, puts an emergency label on it that has, your name, address, allergies, various things on it. But there's also an insert that you can put additional information, your medications, your doctor contact, emergency contact, anything that you want to put in there.
I helped to collect the cans. I helped to get those programs where we were doing the presentations, to get those scheduled. I did some of the presentations myself, but I was a lot of a behind the scenes kind of person. I was, there's a lot of the physical part of it where you're getting the tennis ball cans. You've got to take the old labels off and clean them up a little bit and then put the new labels on. And so, we would have what we called label parties, where we would get together and, do this, and, with some grunt work involved. But
people who receive the can put their emergency information in it, put it up on top of their fridge, and if an EMT comes along to transport the person, they can grab that can and take it with them. It provides blood type, allergies, and so on, so immediately they know the situation when they are dealing with the person, if they're incapacitated and can't speak. Been involved with two, Plan in the Can, where we're collecting tennis ball cans and recycling them as emergency notifications that people can keep in their house. And I'm also involved with affordable housing. That's an ongoing project. It was the fact that everybody worked together so well. Everybody had a different talent and used that talent in a coordinated effort.
Well, the goal was to get as many people as possible in Hall and surrounding counties to have a way of communicating their advance directives, wants, wishes, if you will, to first responders. Because, most people don't think through what they want, what kind of care, medical care they want when they're no longer able, to function at 100%. We don't like to go there, it's not something we like to think about. But it's so important that there is a way that you've established your needs and put it down on paper. And then it takes the strain off of your family for coming up with what do you want and how do you want things administered and, that kind of thing.